morning. Thank you for the opportunity to present my organizational analysis of St. Luke's University Health Network. Throughout this presentation, I will summarize my assessment of the network's strategic initiatives, organizational structure, and value-based care strategies. I will conclude with 3 evidence-based recommendations designed to strengthen organizational agility, improve patient outcomes, enhance workforce stability, and support the network's long-term financial stability. St. Luke's University Health Network is one of Pennsylvania's largest integrated healthcare systems and has established a strong reputation for delivering high-quality, patient-centered care. However, like many healthcare organizations, it continued to face challenges associated with workforce shortages, increasing financial pressures, value-based reimbursement, and growing patient expectations. My organizational analysis identified opportunities to strengthen communication, workforce stability, and community engagement while maintaining the network's commitment to quality and financial sustainability. The 3 recommendations presented today are designed to improve organizational agility, enhance patient outcomes, strengthen employee retention, and position the network to continued success in an evolving healthcare environment. St. Luke's has served the region for more than 150 years and has grown into one of the largest nonprofit integrated healthcare systems in Pennsylvania. Today, the network includes 16 hospitals and more than 350 outpatient care sites throughout Pennsylvania and western New Jersey. The Bethlehem campus serves as the flagship hospital and is designated as a Level 1 trauma center, providing advanced emergency and specialty care. St. Luke's has built a strong reputation for clinical excellence, innovation, and community engagement while remaining committed to delivering safe, high-quality, patient-centered, and cost-effective care. While St. Luke's has experienced significant growth and consistently delivers high-quality care, several organizational barriers continue to affect strategic performance. From an access perspective, emergency department overcrowding, workforce shortages, and increasing demand for services creates challenges in providing timely patient care. Quality barriers include maintaining consistent care across a large integrated network and improving care coordination among multiple disciplines and care settings. Financially, the continued transition toward value-based reimbursement and shared risk payment models pushes the network to improve quality while controlling costs. Combined, these barriers reinforce the need for innovative strategies that strengthen communication, workforce resilience, and community partnerships while maintaining financial sustainability. The St. Luke's network utilizes an integrated matrix organizational structure that combines centralized leadership with interdisciplinary collaboration across hospitals, service lines, and outpatient facilities. This structure supports the organization's strategic goals by promoting collaboration, resource sharing, and standardized clinical practices throughout the network. However, the complexity of a large system can create communication challenges and slower decision-making across multiple departments and leadership levels. As healthcare continues to change, strengthening interdisciplinary collaboration and leadership communication will help enhance organizational agility, consistency, and responsiveness. Expanding team steps and investing in leadership development are evidence-based strategies that align with the network's current organizational structure. Value-based purchasing is a reimbursement model developed by the Centers for Medicare and Medicaid Services that connects hospital reimbursement to performance and quality rather than the volume of services provided. Hospitals are evaluated using measures such as clinical outcomes, patient safety, patient experience, and cost efficiency. My analysis found that value-based purchasing encourages organizations to constantly improve quality while remaining financially responsible. For St. Luke's, success under this model requires strong interdisciplinary collaboration, data-driven quality improvement, and continuously monitoring performance to optimize both patient outcomes and reimbursement. Shared risk contracting shifts healthcare reimbursement from paying for individual services to rewarding organizations for improving the health of defined patient populations. Under these models, providers share financial responsibility for both the quality and cost of care, making care coordination, preventative services, and chronic disease management paramount. My analysis found that organizations investing in population health initiatives, strong community partnerships, are better positioned to reduce avoidable hospitalizations, improve patient outcomes, and succeed under value-based reimbursement. For St. Luke's University Health Network, strengthening partnerships with primary care providers, behavioral health organizations, and community agencies will improve health outcomes while supporting long-term financial sustainability. My first recommendation is to expand team steps and interdisciplinary collaboration throughout the entire St. Luke's network. Team steps is an evidence-based framework that enhances communication, leadership, situation monitoring, and mutual support among healthcare teams. SHI in 2024 evaluated Team Steps implementation in the perioperative care and found significant improvements in patient safety, including reductions in perioperative mortality, critical transfusion events, and improvements in patient identification. Hassan also demonstrated that Team Steps training significantly improved teamwork perceptions and patient safety culture among newly graduated nurses, with effects that were sustained over time. Combined, these findings indicate that expanding Team Steps training can strengthen interdisciplinary collaboration, improve patient safety, and support St. Luke's commitment to delivering high-quality, value-based care. My second recommendation is to strengthen workforce development and retention through leadership development, mentorship, nurse residency program, and succession planning. Workforce shortages remains one of the greatest challenges facing healthcare organizations today. Aiken in 2023 surveyed more than 21,000 clinicians across 60 magnet hospitals and found that poor work environments were significantly associated with higher nurse burnout, job dissatisfaction, and intent to leave. Supporting these findings, Kippleton in 2025 conducted an umbrella review of 14 systematic reviews encompassing 674 primary studies and concluded that multifaceted strategies, including mentorship, supportive leadership, professional development, and nurse residency programs, consistently improved nurse retention while decreasing turnover. By investing in these initiatives, St. Luke's can build a resilient workforce, improve employee engagement, reduce recruitment costs, and sustain high-quality patient care. My final recommendation is to expand community partnerships and health population initiatives. As healthcare continues to shift toward value-based purchasing and shared risk and reimbursement, organizations are increasingly accountable for improving health outcomes beyond the hospital setting. Zaman in 2024 conducted a randomized controlled trial demonstrating that community health workers' intervention significantly improved screening and referral completion compared with standard care. Similarly, Smith and Washburn in 2025 found that community-based interventions improved hemoglobin A1C, reduced blood pressure, and supported weight loss among patients with chronic disease. These findings support that investing in community partnerships can improve care coordination, reduce preventable hospitalizations, and address social determinants of health. For St. Luke's, strengthening partnerships with primary care providers, behavioral health organizations, and community organizations will support improved patient outcomes while enhancing financial performance under value-based reimbursement models. Combined, these three recommendations create a comprehensive strategy for improving organizational performance at St. Luke's. Expanding Team Steps strengthens communication and patient safety, while workforce development initiatives improve employee engagement and retention. Community partnerships extend care beyond the hospital settings by improving care coordination and addressing social determinants of health. Collectively, these strategies improve access to care, enhance quality outcomes, and support cost-effective healthcare delivery. By aligning organizational culture with value-based purchasing and shared risk reimbursement models, St. Luke's will be better positioned to deliver high-quality, patient-centered care while maintaining longer-term financial sustainability. In summary, St. Luke's University Health Network has established a strong foundation for delivering high-quality, patient-centered care. However, the continued transition toward value-based reimbursement, workforce challenges, and increasing community health needs require strategic action. Expanding team steps, strengthening workforce development and retention, and investing in community partnerships are evidence-based recommendations that will improve access, quality, and cost-effectiveness while supporting long-term organizational sustainability. Combined, these initiatives will position St. Luke's to remain innovative, agile, and responsive healthcare leaders. Please let me know if you have any questions. If there are no further questions, I will finish with this final thought. Together, these recommendations position St. Luke's University Health Network to continue delivering exceptional, patient-centered care while remaining financially strong and strategically prepared for the future.